My name is Dr. Suhyun An, and today I wanted to speak to you about a condition called spondylolisthesis. When I was a student, which is a long time ago, this is a condition that we were taught that we will see about 2 to 3%, a very small group of patients will be seeing as a doctor. However, I have a suspicion that it is actually a lot more than 2 to 3%, because it seems to me that we're seeing these patients with a spondylolisthesis almost every week. So what exactly is a spondylolisthesis? You're looking at a normal side view of a lower back spine, and sometimes due to degenerative arthritis or traumatic events such as a slip and fall, or you landed on your butt, this part of the spine called pars interarticularis could end up damaged or fractured. So what it does is your spine could actually slip forward, which is the meaning of the word spondylolisthesis, meaning spine has slipped forward. Okay, so the severity of the spondylolisthesis is measured by how much of the slippage there is. I have personally never seen spondylolisthesis more than 40% in the clinic in the 19 years in my career. Some patients don't even know that they have it, or the spondylolisthesis could be very subtle, that it may not be seen very easily on a plain film x-rays or even a MRI study. And sometimes it is only seen when the x-ray is taken, when the patient is standing up, and with that weight-bearing position, it could show up as well too. So it may not be a serious position, but a lot of these patients suffer from chronic lower back pain that never seems to be helped with anything. And there are a couple of suggestions that I can make you, and that is these patients that has this particular presentation of spondylolisthesis. If you are a female patient, you really should not wear or really avoid wearing a high heel, where it will tilt the pelvis forward, because it's going to accentuate this shearing force that your spine is experiencing due to this damage. Another thing that you could do is abdominal strengthening exercise by laying flat on the floor and lifting the leg up. It will reduce the shearing force in the lower back. Not to mention, it will strengthen your lower back spine and abdominal muscles as well. Another thing that you have to watch out for is try not to gain a lot of abdominal weight, because it will make that shearing force of the spondylolisthesis much worse as you get older. Spondylolisthesis can be greatly helped with doing decompression therapy, and the decompression therapy needs to be set at a certain angle according to the patient's spondylolisthesis presentation. And we've had a great result with these patients who come in, and doing a regenerative injection such as PRP or core tissues, or the fat-grafted stem cell therapy into what's called a facet joint also have been very successful in here, giving the patients a long relief from the chronic pain.